Hi, ladies and gentlemen. This is Dr. Jaime Daniel, and today we are just retaking our program after a long of quiet. Well, I hope you will enjoy this program today. I want to share with you some information about pain, but pain in cancer. But first at all, we need to understand what is pain. And about pain, we can say that this is an unpleasant sensory and emotional experience that affects most aspects of life. And those include physical functioning, daily activity, psychological and emotional status, and even social life. Of course, pain is a complex symptom and there is substantial heterogeneity in how it is experienced and in how it is manifested. In many cases, this constellation of symptoms and signs can suggest a specific cancer pain syndrome. And of course, we need to remember that the word syndrome do reference to collecting or a group of symptoms and signs. So, the identification of such as a syndrome may help to elucidate the etiology of the pain, direct the diagnostic evaluation, clarify the prognosis for the pain or the disease itself, and of course it guides therapeutic intervention. So, if we are now focusing on cancer, specifically cancer pain syndromes, it can be broadly characterized as acute or chronic. When we talk about acute pain syndromes, usually accompany diagnostic or therapeutic interventions, whereas chronic pain syndromes usually are directly related to the neoplasm itself or to an anti-neoplastic therapy. Well, if we have to talk about the case of acute pain syndromes, most of these acute pain syndromes in cancer are iatrogenic. I mean, they happen because there's been a procedure that didn't go well. Of course, this is related to some diagnostic tests or treatments. However, some are disease related, such as a pain due to acute hemorrhage into a tumor, bone pain from a pathologic fracture, or visceral pain from acute obstruction or perforation of a hollow structure. We can manage it by using some analgesic, but you need to understand that there is a breakthrough pain, and it is typically defined as a transient flare of moderate to severe pain occurring on a background of chronic pain that is adequately controlled by opioid regimen. This flare of pain is typically short-lived and is usually related directly to the cancer, a cancer treatment or a diagnostic test. The management of this breakthrough pain will require more specialized focus. And well, by the other hand, we can talk about patients receiving chronic opioid therapy for persistent cancer pain. And in this case, the term breakthrough pain is not used to describe singular events of acute, severe and longer lasting pain that occur after surgery or after an injury. Whether or not the pain is related to the cancer, for example, a pathologic bone fracture, the management of this sort of severe acute pain is similar to that for patients who are receiving long-term opioids for chronic non-cancer pain. Of course, the origin of the pain is different, but the mechanisms are very quite similar. You need to focus in blocking some metabolic pathways. And well, the acute pain syndromes are directly related to the tumor, and why shows you the necessity to urgent treatment of the underlying lesion. And in addition, you need to be more aggressive controlling this pain. For example, you can be part of a patient who is suffering hemorrhage into a tumor. Maybe you are suffering from pathologic fractures, or another possibility if we are in front of an obstruction or perforation of a hollow viscous. For example, the obstruction of the bile duct, ureter, or bowel lumen by an intra-abdominal or pelvic cancer or retroperitoneal fibrosis can also present with acute severe pain. Relief may be obtained urgently through percutaneous decompression stenting or occasionally surgery. Also, we have the superior vena cava obstruction and the pain due to acute thrombosis. We need to remember that deep venous thrombosis, most often in extremity, is a relatively common complication of cancer and is usually associated with pain and swelling in the limb. Of course, if we don't have the proper amount of oxygen, of nutrients that are carried on by the blood, probably your body is going to die very slowly, but enough to produce you a pain that sometimes it's very acute and very hard to tolerate. Beside that, the acute pain can be also associated with all types of antineoplastic therapies. It includes chemotherapy, hormonal therapy, immunotherapy. Pain is highly prevalent during treatment, and the likelihood of significant treatment associated with pain varies with the disease and its treatment. A systematic review noted a pooled prevalence rate of 40% during cancer treatment across all treatments and conditions. Another point that we would like to clarify and speak more is about the chronic pain syndromes. Approximately 3/4 of cancer patients who have chronic pain have nociceptive, which is mineral receptor that could be somatic or visceral, or even neuropathic syndromes that represent direct effects of the neoplasm. Other causes of chronic pain in cancer patients are antineoplastic treatment. The disorders that are unrelated to the disease or its treatment also need to get special attention. Significant barriers to better understanding chronic cancer pain syndromes, their prevalence and their consequences, is the lack of consistent diagnostic criteria for specific syndromes. At present, they are classified according to the putative mechanism and the underlying type of pathophysiology inferred from the pain characteristics. Consensus-based core diagnostic criteria for several cancer-related pain syndromes, especially bone pain, chemotherapy-induced peripheral neuropathy, and pancreatic cancer-related pain, has been published. Well, of course, some of these problems are the tumor-related somatic pain syndromes, the multifocal bone pain, it can happen in vertebral pain syndromes, and also in pelvic and hip metastases, and a vase of skull metastasis. For example, it's not that you will experience a fracture, but probably you will be experiencing some form in some degree of the osteoarthritis. And it is a way that you can use to predict or at least to think about what is going on with you. And well, also the soft tissue could be affected and produce the pain. For example, when we talk about sarcomas, they can arise in the muscle and they can do metastasis. In either case, pain at the local site of involvement is common. Muscle pain may also be due to muscular cramps, which in cancer patients can be associated with neuronal injury. Biochemical abnormalities such as hypercalcemia or hypernatremia may be the result of paraneoplastic syndromes. Treatment of cancer-associated muscle cramps is non-specific and employs the same approaches used to manage cramps in other disorders. Somatic chest wall pain is common among patients with cancer lung, or also known as a mesothelioma, and can be due to direct tumor infiltration of these ribs, intercostal space, or parietal pleura. Well, it's quite obvious that we are talking about the lungs and its parts that are being affected by the cancer. In this case, the pain usually is worsened by the deep inspiration or cough. And a malignant intercostal non-neuropathic may accompany these lesions and yield a syndrome that has mixed nociceptive and neuropathic features. In the soft tissue pain, it can be also be caused by a paraneoplastic disorder. For example, hypertrophic osteoarthropathy. And we need to list some of them. For example, tumor-related visceral pain syndromes. In this group, we can talk about hepatic distension syndrome, the midline retroperitoneal syndrome, chronic intestinal obstruction. In this case, you need to pay very attention and be very careful, because you will handle it as an obstruction with etiology knowing the etiology, and probably will confuse you confuse the patient, and this is something that is not helping, because you need to save time as soon as you can in this kind of treatment. In this list of chronic pain, you also can say that there is a peritoneal carcinomatosis, malignant perineal pain, adrenal pain syndrome, and urethral obstruction. Of course, when we are talking about the tumor-related neuropathic pain, it's because you are getting some involvement of the neurons or the spinal cord, nerve roots, plexus, or peripheral nerves. Also, you can get the leptomeningeal metastasis. In this case, any solid or hematologic hemoplasm can potentially infiltrate the leptomeninges, but the common tumors are lung and breast cancer, lymphoma, and leukemia. Well, we need to remember the radiculopathies. It also means a nerve inflammation. So it will cause different degrees and different symptoms in which the patient described them in a plenty variety. Some say that they are feeling tickles, they are feeling burnings, they are feeling like bug bites, or maybe they are just feeling that like if they were walking on sand, wet sand. And of course, we also need to mention the plexopathies. This is when we talk about connection, about more and more nerves. It includes the cervical plexopathy, brachial plexopathy, the celiac plexus, lumbosacral plexopathy, Now, always always getting these nerves in pain. It's a way to add more classification. For example, the peripheral mononeuropathies, paraneoplastic syndromes, where we got a subacute sensory neuropathy. We also got the hypertrophic osteoarthropathy. Of course, you will experience headache, chronic pain related to antineoplastic treatment. In case you need to talk to your doctor to get new prescription or new options. Chemotherapy-related neuropathy. Although painful peripheral neuropathy resulting from cytotoxic therapy usually subsides over time, some patients develop persistent chronic pain. The pain is similar to other axonopathy, which initial involvement of the feet and distal legs, followed by the hand and arms. The severity of pain and the presence of and degree of neurologic impairment vary widely depending on the agent to which the patient was exposed and to the dose. Occasion, of course, this is something that I am missing to share with you. But when we are talking about this medication to treat cancer, we are talking about some products that, in fact, are a type of venom to get rid of these cancers. You can also experience bone complications if you are consuming glucocorticoids in a chronic way. Also, there is anti-androgens and gynecomastia in men, creating or generating some painful development in the majority of males receiving therapy for anti-androgens alone for advanced prostate cancer, unless prophylactic resonance tomography is also required. Post-surgical pain syndromes. It's not a particular one from neoplastic disease, but is something that you can experience. This is quite normal, so don't worry. You also will experience pain and phantom sensation after limb amputation. It's more frequent in soldiers on those who suffered some accident where they lost a limb, for example, an arm or a leg or part of them. So your brain is not losing the neuronal connections, so the fact that there is no longer a hand or no longer a foot doesn't mean that your brain has erased that part of that it settled to represent, to control the movement or the sensations from that part. The post-radiation pain syndromes, of course, you will get radiotherapy, and after this you will experience some kind of pain. For example, once again, you will suffer for plexopathies, myelopathies, gastrointestinal tract, in the way of chronic enteritis and proctitis. Those may result from aeration of the abdomen and pelvis. Also, you will find pain due to lymphedema. The lymphedema is more simple to manage, but since the first cause of this lymphedema is the cancer, it will turn into something recurrent, and you need to be aware of that to be more patient with yourself. And also, in a more advanced degree, we got the osteonecrosis. In this case, the osteonecrosis is very important to do earlier diagnosis and start the treatment as soon as you can, because the patient will be in high risk to develop spontaneous fractures. Well, I hope you enjoyed this episode, and we will get more information. But if you want to get a resume, I will tell you that look, the cancer pain syndrome is defined as a clinical meaningful constellation of symptoms and signs in a patient with cancer. You have two types of pains. One is the acute pain syndromes, and the second is chronic pain syndromes. In the acute pain syndromes, usually they are accompanied by diagnostic or therapeutic interventions, although some are directly related to the maleficent itself, the cancer. And also, when you are talking about chronic pain syndromes, they are usually directly related to the cancer itself or to an antineoplastic therapy or surgery or radiation therapy. Well, once again, I hope you enjoyed this episode, and we will see you in the next one. Thank you.